today's webinar, How to Start a New Career in Healthcare. My name is Jennifer Christensen, and I'm the System Manager of Training and Development at Herzing University, and I am privileged to moderate a relevant and timely discussion presented by Herzing and a dynamic group of thought leaders in the healthcare industry. As a nonprofit university, with over 70% of our current students preparing to become nurses and healthcare leaders, and with over 12,000 and counting alumni serving throughout our country during this challenging pandemic, this topic is near and dear to our hearts. We are proud and we thank all of those who are skillfully and graciously making a difference during this difficult time. With that said, first, let me share what we'll cover today. First of all, I'll introduce our presenters. Then we'll hear from industry leaders on the current state and impact of COVID-19 and the future state of healthcare. And finally, we'll explore career pathways and the degrees that support them. Please submit any questions via the chat box, and we'll direct those to our presenters at the end of our session. Also, if you have any technical difficulty, send a message and someone will attempt to assist you. Now, I am delighted to take a few minutes and introduce today's presenters. First, we have Eloise Williams, who serves as a nursing recruiter for Toro Infirmary LCMC Health in New Orleans. She started her healthcare career as a surgical tech and later completed her nursing degree and became a certified operating room nurse. She has over 30 years of healthcare experience, working mostly in surgery, and has also held positions as a director of case management, director of a freestanding ambulatory surgery center, and more. Welcome, Eloise. Dr. Nancy Johnson. Dr. Nancy Johnson is the Chief Executive Officer for El Rio Health, one of the largest federally qualified health centers in the country. She is a registered BSN nurse, holds her master's degrees in both nursing and business marketing, as well as a PhD in healthcare. Nancy has held positions as a clinician, a faculty member in nursing, an administrator, and more. Dr. Johnson is a recent recipient of the University of Arizona's Cecil B. Hart Humanitarian Award, as well as the recipient of the 2016 Distinguished Alumni Award from Illinois Wesleyan University. Welcome. Dr. Brendan Ashby serves as the Division Healthcare Chair for Herzing University. Dr. Ashby came to Herzing University after serving as a Dean of Health Sciences in the Minnesota State Colleges and Universities system for over 7 years. Dr. Ashby comes with a wealth of knowledge, as well as degrees, including Doctorate of Education in Interdisciplinary Leadership, a Master of Business Administration in Healthcare Administration, a Master of Public Health in International Health Policy and Management, and a BA in Political Science. Dr. Ashby is a Master Certified Health Education Specialist. He is also board certified in healthcare management and a fellow of the American College of Healthcare Executives. Welcome to Dr. Ashby. Dr. Dina Hewitt serves as the Associate Dean of Nursing at Herzing University and has over 30 years of experience as a critical care nurse. Her career has encompassed both hospital administration and academics. Her certifications include CCRN Alumnus, Nurse Executive Advanced, and Six Sigma Black Belt. During her tenure in hospital administration, she served as the unit manager of the cardiothoracic ICU and director of nursing in multiple units, including critical care, inpatient rehabilitation, and respiratory therapy. Dr. Hewitt is an Asen Wharton Executive Fellow, leader for the Georgia Nurses Association, board member of the Georgia Association of Nursing Deans and Directors, and also serves on the Government Affairs Committee of the American Association of Colleges of Nursing. Her recent publications include Fast Facts for the Critical Care Nurse. Welcome to Dr. Hewitt. At this time, I'd like to hand it off to our industry partners, Eloise Williams and Dr. Hewitt, Dr. Nancy Johnson, to share their thoughts on the current and future state of healthcare. Eloise, I'll turn it over to you.
Hi, thank you for having me to discuss this increasing demand of healthcare workers. It is really troubling, the world we're living in right now. But healthcare is the fastest growing job industry right now in the nation. The supply of nurses has stayed the same since the year 2000. So we're putting out the same amount of nurses, but the demand has steadily increased over the past 20 years. This is anticipated that the United States will be facing a shortage of more than 1 million nurses compared to today's shortage. So the supply and demand ratio is related to several factors. As everyone can see, that people are generally living longer, they're healthier. We are focusing more on exercise and eating right. So we're seeing patients who are in their 90s requiring facilities because they are not able to be cared for by their children because their children are now in their 60s and 70s. So this increases the need for more allied health professionals. In turn, the baby boomer population, we are going to start, have not already retired, will be retiring pretty much by the year 2025. This is 46% of the nursing workforce. Therefore, we do need to plan and prepare for the healthcare needs of this aging population. The other factor is the advancement with the disease process. People are living longer with cancer, heart disease, organ transplant recipients, and patients with HIV. These complex diagnoses require more coordinated patient care across multiple disciplines. Another factor or ratio is the ratio of females in nursing. Females comprise 91% of that workforce. This equates to an average of 9.5 females to every male nurse. Of that 91%, only 70% are working full-time. Of that 70%, 54% is of the age of 20 to early 50s. And as you well know, this is difficult on the healthcare provider because this is of childbearing ages. And it can be very problematic for staffing. We need to allow time for mother-baby bonding and so forth. So that can really, put a factor in just needing someone to fill in for 3 months. Also, now when you add COVID-19 into the mix of these workforce demands and the nursing shortage, the healthcare system can become strained, and we see these demands become more and more clear. So going into the COVID, as you have been watching the news, New Orleans was really, really hit hard. We had over 10,000 cases of COVID just in New Orleans. And unfortunately, just in the past 24 hours, yesterday, we marked an additional, in just one day, 120 deaths. My hospital, Touro, was one of the first hospitals that admitted a COVID patient. We had in place and do practice the emergency preparedness that was required by our government, but nothing could prepare us for what just happened this last month. But I will have to say, everyone within our hospital, we jumped into a manner of what can we do, what needs to be done. Our maintenance department reconstructed many patient rooms to provide the negative pressure for infection control for the COVID positive patients. I'm in human resources, and we opened up a daycare for ages 5 to 11 to assist with a healthcare worker that their schools for their children were all closed. And the first thing we needed to do was make sure our nurses could come to work. So in 4 days, we opened up a daycare. That was a little stressful, but it is doing quite well. We've really been amazed with that. Our material management department implemented quick communication with vendors to search for supplies. we had enough supplies for our staff. We were not like other states that was challenged to get supplies. We did well. Mostly, I think it's because we're a part of a system hospital, but we were fine with getting supplies. What we're challenged with, though, we have closed our ambulatory surgery centers, our main operating rooms, only opened for emergencies, and our clinics. So these healthcare workers were reallocated to several departments to provide assistance in the hard-hit departments, the ICUs, and our COVID positive departments. The surgical techs went to central supply to assist with restocking the units, receiving supplies, and things like that. The orderlies from surgery were reallocated to assist with transportation of patients from the emergency room to the ICU or to the floors. Then the clinic nurses were reallocated to support the ICU and the COVID positive units. They were called nurse extenders. So they helped the nurse and aided in any way they can. It was maybe helping with positioning patients because we had to turn them so many hours to prevent pneumonia and things like that. So they were a great help. Even myself as a nurse in human resources, I went and did triage for the COVID tent, taking temperatures and taking vitals and sorting them as to where they needed to go. And I also did fit testing for the N95 mask and respirators throughout the entire hospital. So we all took part, we all jumped in, and I do believe that when this is all said and done, we are going to have several meetings about this to review. Hindsight is always 2020. This is everyone's first international pandemic of this magnitude. But how we change and what we do for the next pandemic remains to be seen. I personally feel that we all rallied together to provide the necessary care for our patients. Additionally, being part, like I said before, of a system was a true advantage in obtaining supplies, providing extra care, and pulling in the most unusual places of staff that you could imagine. Even our hospital has been providing free lunch for our staff to help out economically with what's been happening. So, thank you.
Eloise, thank you. On behalf of Herzing and particularly our campus in New Orleans, we thank you and we applaud your work. Now I'd like to turn it over to Dr. Nancy Johnson.
Thank you. That was just really inspirational to listen to, and our thoughts and our prayers are with all of the nurses and the healthcare workers in New Orleans. So I'm here in Tucson, Arizona. I wanted to first thank you for inviting me to join the webinar today, because I think that I can bring a different perspective. I've been a nurse for more years than I care to mention. And I've been really honored to have a lot of opportunities. And so I always think when people are entering the healthcare field, we have about 1,500 employees. Many of them are in different stages of their career development. And healthcare, nursing specifically, in my case, just brings countless opportunities as clinicians, as educators, as leaders and administrators. And I think this demand, I also agree, will continue to grow with our diverse population that we're providing care for in all of our communities. And the focus not only on improving quality of care for people, but also including in improving the patient experience and also decreasing cost of care. And, you know, today I wanted to share a little part of my healthcare experience as a newly minted registered nurse many years ago and tie that to today's pandemic that we're addressing. My very first position as a registered nurse was in an urban, large inner city hospital, and worked on a general medical unit and then transferred into the ICU. And over the course of a couple years, I saw so many of the same patients coming in, going out, coming in, going out. And it for the first time, I really recognized that their life outside of the hospital was the most powerful in creating health. And I felt like I needed to be there, hence my transition to really public health and community health nursing. And we all recognize our need for fabulous hospitals and hospital systems and trauma units. But where I live and work as a healthcare professional is in the community, working in public health and community health nursing in a large federally qualified health center. Right now, with the pandemic, we are sitting in the front lines protecting the hospitals. We see our role during this pandemic is to keep the hospitals safe and to keep the ability to take care of the critically ill and to have enough beds and have enough nursing staff and other healthcare professionals to take care of the most acutely ill. So what's happening in our world and where we go with our emergency preparedness team is around primary prevention and secondary prevention. Knowing the hospitals have the tertiary care side of health covered. So in primary prevention, all of our team, our nurses, our medical assistants, our pharmacists, our radiology technicians, our laboratory assistants, all the folks that make up our interdisciplinary team of healthcare on the front line have been educating our patients through text messaging, social media, emails, reaching out to them, letting them know you stay home, social distancing, hand hygiene, all the precautions we have been educating our patients on. Making sure that if they haven't had a flu shot yet, they're getting immunized is another piece of primary prevention. And then the secondary prevention that we provide in our organization is, as you see on your screen, some of our staff out manning the triage tents in looking to screen and early detection so we can isolate and or quarantine individuals. So we're really working from a population health perspective in trying to really manage a large group of people so that only those who truly need to be hospitalized will indeed be hospitalized, trying to keep those hospitals from being overwhelmed. Our staff have really worked on identifying, some of the silver linings to this first international pandemic. The landscape of healthcare will be changed and probably most likely continue to change. But some of the things that we've seen in the patients we take care of about 114,000 unique people in our community. We've obviously seen a lot of our patients postpone their preventive care, immunizations and well visits, things like that for their children or themselves. And so what that has challenged us to do is to rapidly innovate in the healthcare industry. So from doing just a few telehealth visits in the past months, all of a sudden with COVID-19, we are doing close to 1,000 telehealth visits with our patients every day. Texting them, as I mentioned earlier, to set up these telehealth visits, but being able to see them, to see how are they breathing, to see how their diabetes is doing, to see if their child's asthma is exacerbating. So all those things that we're doing on telehealth jumped up with this opportunity and this necessity to innovate for our patients. We also see the scope of practice changing with this pandemic in that many of our employees, as you heard earlier in the first scenario, many of our employees are working from home now too, and also doing a lot of outreach to our patients, talking to others at some of the other community centers. Since we've had quite a bit of our workforce displaced because of a lot of folks pointing off their preventive care, we've used our staff members to help screen in community settings. They've been out in apartment complexes where there's small clusters of COVID so that we can avoid having the community spread progressing. Lastly, what do we see for the future? I think we're going to be very, very busy post-COVID. I think that technology around telehealth and many other ways of communicating and reaching our patients is here to stay. I think we'll see roles change for various healthcare professionals. We've seen a lot of our medical assistants become part of our response team that goes out to each of our many locations when we have a COVID positive patient to talk to those exposed, to make sure everyone feels safe and have their fears addressed. So I think we'll see a lot of roles change and expand across our healthcare professionals. I think we'll see some staffing ratios change. And I think we'll also see a renewed recognition of the power and the importance of primary and secondary prevention in keeping our communities healthy and safe. And with that, I'll stop and pass on to the next panelist.
Thank you very much. That was very insightful. And I think we can all appreciate your silver lining approach, looking at the opportunities and the innovations during this difficult time. So thank you for sharing. Thank you to both of our industry leaders. Now it's my pleasure to hand off to Dr. Ashby, who will provide information on healthcare career pathways, starting with those that are considered non-direct patient care and the education behind them.
Thank you, Jennifer, and good afternoon, everybody. Yeah, these careers are fantastic opportunities for folks to have a role in healthcare, have a career in healthcare, but not necessarily if they don't want to provide direct patient care. So let's begin with healthcare management. Some key roles and responsibilities in healthcare management. So a career in healthcare management puts you in a leadership position to improve efficiency and quality in delivering healthcare services. As a healthcare management professional, you develop departmental goals, recruit, train, and supervise staff members. But what about job demand? So job demand data from the U.S. Bureau of Labor says that employment of healthcare management is projected to grow 18% from 2018 to 2028, much faster than the average for all occupations. The median annual wage for the medical and healthcare service managers was over $99,000 in May 2018. Now, keep in mind that the wages are highly dependent on experience, geographic location, and educational background and organization. So what type of jobs could you get with a degree in healthcare management? Well, I'll talk about two examples. The first is clinical managers. So clinical managers, they oversee a specific department such as nursing, surgery, or physical therapy, and have responsibilities based on that specialty. Clinical managers set and carry out policies, goals, and procedures for their departments, evaluate the quality of the staff's work, and develop reports and budgets. Second, we have office managers, and they oversee a medical office. Office managers are responsible for hiring and training of office staff, maintain schedules, handle patient issues, and evaluate the quality of staff's work and develop reports and budgets. So now let's take a look at some degrees and pathways forward. So a great start would be at the associate degree level. So the associate degree in healthcare administration, that can be completed in as few as 16 months. And then you could add on to that through a bachelor's degree in healthcare administration or healthcare management that can be completed in as few as 36 months. And there are two concentrations in the bachelor's degree, leadership and managed care. You could also add on an MBA in healthcare management, which can be completed in as few as 12 months. Now, internships and capstones, those are all part of the degrees that I just spoke about. So students, they have an opportunity in their final term to do an internship at a healthcare organization, or they can do a capstone, which is a research paper and final program presentation based upon a healthcare management topic. Now let's talk about health information management. So some key roles and responsibilities. A career in health information management puts you at the center of the emerging fields of healthcare management, information technology, and reimbursement. As a health information management professional, you are the expert on patient data that doctors, nurses, and other healthcare providers collect and rely on to perform their jobs. But what about job demand? So job demand data from the American Health Information Management Association and the U.S. Bureau of Labor Statistics shows that health information professionals are projected to grow 11% from 2018 to 2028. So demand is on the rise at all levels of education and credentialing. Health information professionals are one of the 20 fastest growing occupations in the United States. What type of jobs could you get with a degree in health information management? At the bachelor's level, you could be an HIM director, patient information coordinator, or data quality manager. And with an associate's degree, you could be health data analyst, an insurance claims analyst, or a records technician specialist. So let's look at some degrees and pathways forward. Again, it's always a great idea to start at the associate's level. So you could do the associates in healthcare information management and complete that in as few as 20 months, and then stack on a bachelor's degree in healthcare information management and complete that in as few as 36 months. And then add on an MBA in healthcare management and complete that in as few as 20 months or 12 months. These degrees all come with an internship component that the students will complete at the end of their training. So now let's take a look at medical billing and insurance and medical coding. So some key roles and responsibilities. So medical billers ensure that the billing of services is handled correctly and that the right person or company is billed or paid. So daily tasks could include auditing and submitting claims for patient visits, diagnoses, and medical procedures to insurance companies, patients, and other payers. Now, medical coders, they review patient information for pre-existing conditions such as heart disease. So patient data can be coded properly, and they assign appropriate diagnoses and procedure codes for patient care and billing purposes. But what about job demand? So job demand from the U.S. Bureau of Labor Statistics shows that employment for medical billing is projected to grow 10% from 2018 to 2028. And employment of medical coding is projected to increase 11% from 2018 to 2028. So what type of jobs could you get with a medical billing or medical coding degree? Well, you could be a medical coder, medical billing and insurance specialist, or an auditing specialist. All right, so let's take a look at some degrees and pathways forward. Again, it's always a great idea to start at the diploma degree, and looking at these degrees, the diplomas, you can complete them for medical and billing and insurance. You can complete that in as few as 8 months, and then get a diploma in medical coding. That can be completed as few as 12 months. Now, for the associate's degrees, all of those can be completed in as few as 20 months.
Dr. Ashley, thank you. You've shared a lot of information with us on opportunities in non-direct patient care. I'd like to transition and talk about a popular direct patient care role, which is an entry into healthcare, and that's the role of medical assistant.
Certainly. Medical assistant is a fantastic opportunity for folks that are interested in working in healthcare and especially working in a direct patient care role. So some key roles and responsibilities. So medical assistants take and record patients' personal information and they measure vital signs. They also give patients injections and medications as directed by physicians. Medical assistants, they really want to make a difference and work directly with patients. It's a great way to get into healthcare industry quickly. But what about job demand? Job demand from the U.S. Bureau of Labor Statistics shows that employment of medical assistants is projected to grow 23% from 2018 to 2028, which is much faster than the average for all occupations. And what kind of jobs and work environments could you expect with a medical assisting degree? Well, more than half of all the medical assistants are hired in a physician's office, but they can also be hired in hospitals, urgent care, outpatient clinics, chiropractic offices, labs, and other medical facilities. Here are a few common working environments for medical assistants. That could be the front office, the back office, or the laboratory. So for the front office, the tasks would include answering the phone, scheduling appointments, informing the physician about patient concerns, and greeting patients when they enter the office. For the back office, this is a great opportunity to interact with patients, and the responsibilities may include measuring vital signs, obtaining the patient's medical history, and you may even assist in treating patients. And finally, the laboratory. You might be responsible for drawing blood, pregnancy tests, drug screens, or other in-house lab procedures. So here are some degrees and pathways forward. So again, it's a great idea to start at the diploma level in medical assisting, and that can be completed in as few as 10 months. Or you could then go on to the associate degree in medical assistant, and that can be completed in as few as 20 months. Both of these degrees have an externship option. And so students, they have the opportunity to complete an externship at a medical facility working under the supervision of a physician.
Thank you very much, Dr. Ashby. That is great information on non-nursing pathways, whether direct patient care or non-direct patient care in more of a business and leadership role. So what I'd like to do now is turn it over to Dr. Dina Hewitt, who brings a wealth of nursing experience to share nursing pathways with us. Dr. Hewitt, I want to make sure you're not on mute. It appears we're having some difficulties. I'm going to give it a minute here. Dr. Hewitt. So what I'd like to do is put the slides up so that we can take a look at the nursing programs that are available. Registered nurses provide and coordinate. Actually, let's go back so I can read that slide. And if Dr. Hewitt comes on, I'm hopeful that she'll jump right in. Registered nurses provide and coordinate patient care. They also educate patients in public health conditions. You could land an ER, travel nurse, or pediatric nurse. So what we'd like to look at is really the message that we send today is the opportunities and the pathways. Starting off with, in as few as 12 months, the ability to earn the role of licensed practical nurse, and then continue.
Hi, I think you can hear me now.
Oh, wonderful, thank you.
Hi.
Yes, welcome.
Apologies, I had, as it goes, connectivity issues. I was in, I could hear you, but I just needed to be unmuted, so greatly apologize for that. So on with the show, as we say. It's a pleasure to be with you today and talk about a career as a nurse. And I always introduce myself and say that I am very proud to be a nurse. So what can nurses do? We can work in many different areas, providing and coordinating patient care, educating patients and the public on health conditions. As many of you have seen in the news recently, nurses have been in the forefront of this COVID-19 pandemic, providing care to our patients, as well as educating about the activities that are happening on the front lines as the frontline heroes. So additional jobs that you could land as a nurse include emergency room nursing, working as a travel nurse, a pediatric nurse, also working in outpatient areas, surgical centers, working as a nurse educator, and also working in hospital administration. And at Herzing University, we're very proud of our graduates that are ready and willing to hit the ground running and to contribute as a nurse and member of the healthcare team with the knowledge and skills to provide excellent patient care. So what are your pathways forward as a nurse? First to start is the licensed practical nurse, or LPN, and in some areas it's also referred to as the licensed vocational nurse, or LVN. And in this degree track, you can complete it in as few as 12 months with about 36, 37 credit hours. And this degree track prepares you to sit and take what is called the NCLEX PN exam, which is the licensure exam to provide care. And for the most part, LPNs work in long-term care facilities or skilled nursing facilities, also assisted living facilities, and in some cases also in hospitals providing direct patient care, doctor's offices, and other outpatient settings. Next is the associate degree program, and this degree program prepares you to become a registered nurse and to take the NCLEX RN exam. This can be completed in as few as 20 months. And we also have the ADN and the ASN, basically the same degree. And we also have the opportunity for you to complete a bridge to the RN degree. So if you are already an LPN, you can complete this in as few as 16 to 18 months. In addition to the associate degree, we also offer the bachelor's degree in nursing, or the BSN. This also prepares you to sit for the NCLEX RN exam and can be completed in as few as 36 months. And this is the total of 120 credit hours. This degree, also providing direct patient care. We also have an option as an accelerated BSN degree track. And this is for someone who may already have a bachelor's degree in another area, but is interested in returning to school to become a registered nurse. And this can be completed in as few as 16 months. Also included is the LPN to BSN bridge. So for someone who is already, again, an LPN that wishes to complete their degree and become an RN, that can be completed in as few as 28 months. In addition, we also offer the RN to BSN, which is offered in a fully online environment, and this can be completed in as few as 12 months. So this is for someone who is already a registered nurse as an associate degree nurse and would like to continue their education and obtain a bachelor's degree. Beyond obtaining the bachelor's degree, the next step forward is the master's degree. And we offer the master's degree as a family nurse practitioner, which can be completed in 20 months, again, in a fully online environment with the opportunity for working and completing clinical in doctor's offices and in hospitals and in emergency rooms. This can be completed in as few as 20 months. We also offer the nurse educator master's degree and the nursing leadership and administrative degree, which can be completed in as few as 16 months.
All right. Well, on behalf of the entire group, Dr. Hewitt, I want to thank you for joining and sharing your expertise with us today. And I want to thank all of our presenters, first and foremost, for your service and dedication to making a difference, and of course, for taking this time to prepare and present valuable information on career pathways in nursing and healthcare. We encourage all of you to visit herzing.edu to learn more, to engage with us also on social media, where you'll see our students, their stories, and how they're making a difference in their communities. As we heard today, there is a real opportunity in front of us. Herzing is well positioned with extensive experience in online learning and a long history of preparing nurses and healthcare leaders to meet the needs of our students. And we are very excited to welcome a new group of students on May 4th, and we're continuing to enroll for the spring and the summer. So please reach out to us if you'd like to set up a virtual meeting to explore if Herzing is a good fit for you or someone you know who is aspiring to start a new career in healthcare. What I'd like to do is move on to our Q&A. I want to thank in advance Jenny, who's been behind the scenes working in chat. She's now going to direct your questions as time permits to our presenters. And I want to just conclude by noting that a copy of the presentation will be emailed to all of our participants today, along with answers to any questions that we're not able to get to as a result of our time. So thank you very much. Jenny, I'll turn it over to you.
Thanks, Jen. We've got a few questions here that hopefully we can answer. If we aren't able to, we'll definitely, again, reach out to you. So the first question is, how can I afford college right now with COVID-19 happening? And I'm going to actually hand that over to Jamie from our financial aid team that I know is on the call.
Are you able to hear me?
Yep.
All right, so good question. Herzing is always committed to working with every single student one-on-one. Right now, in our current situation, we're definitely still holding virtual meetings with students so that we can find the best funding plan. We do offer a number of scholarships for any of our healthcare degrees or diplomas, even our nursing. So it definitely is worth a student's time to reach out to somebody in financial aid just to ask some questions, see what we have available. You can also visit the herzing.edu website, and we have some of those scholarship opportunities listed out there. Herzing's also reviewing all of our internal policies to make sure that we're taking advantage of any of the aspects of the CARES Act that does apply to students and to post-secondary institutions. So we're definitely taking a look at that right now as well. And then real quick, I have a fun fact for everybody. The Federal Department of Education has temporarily postponed interest on all federally held student loans through September 30th. So if anybody's on the line and currently has outstanding federal student loans and you have additional questions about that, definitely reach out to your servicer to get some more detail.
Great. Thank you, Jamie. Much appreciated. Another question here is, how is TEAS testing happening with COVID-19? Dina, could you take that one?
I'm sorry. Could you repeat that? What was the question?
Sure. It was, how is the TEAS testing happening with COVID-19?
Great question. Yes, we are still providing the TEAS testing in a remote, proctored type of environment so that you can register and take the TEAS exam. It would be administered through through admissions and with student services, so that we can still continue to allow you to take that exam and see what those results are.
Great. And then I think I have another one for you as well, Dina, here. Just wondering if our class is all online right now, even nursing.
Yes, right now even nursing classes are being offered online. We switched over, and we are also integrating virtual simulation. So for a student who was doing their clinical activities in the hospital, we've transitioned over to something called VSIM, which is very interactive, very in-depth, and it's guided and mentored and evaluated by the faculty while the students are actively participating in that virtual simulation activity.
Great, thank you. We'll finish with just one more question here, and then again, for anybody else that has asked questions, or if you wish to ask a question yet, feel free to submit it and we'll certainly get an answer to you. But the last question is, what are the admissions requirements for Herzing? Jen, is that something you can respond to?
Well, that is kind of a loaded question because we have admission requirements for different programs, depending upon which healthcare program or nursing program students are looking at. I will say that everything is on herzing.edu, and that would be a good place to start, as well as reaching out to have a conversation, a virtual meeting with one of our admissions advisors. Also, let me give you a number, 855-285-3809. Okay, and with that, we're going to conclude our session today, and I want to again thank everyone for taking the time, particularly for our talented presenters, and we wish you all safety and good health at this time, and thank you again.